spring is in the air. We feel it for millions of Americans. That means seasonal allergies are in full swing. And now new research shows climate change can make allergy season even worse. Experts say if carbon dioxide emissions continue as they are now, the U.S. could face up to a 200% increase in total pollen in the next century. Doctors say there are some things you can do to lessen your symptoms, though.
You want to look and see if the pollen count is high that day. It's going to inform sort of how you wear a hat, maybe sunglasses, protect yourself from the pollen, a mask, have your medication, depending on what you take with you if you need extra.
Research also says in North America from 1990 to 2018, pollen seasons have lengthened by 20 days. So we wanted to learn more about how seasonal allergies are impacting us here in Ohio this season, especially right here in Northeast Ohio. So we are joined by Dr. Sam Friedlander, an allergist with University Hospitals. Thank you so much, doctor, for being with us this morning. I know I am not alone when I say my eyes are watery, my nose is sniffly. So what are you seeing with your patients?
A really rainy spring, and so that's been feeding the plants, and we are starting to see some pretty significant allergies happening right now.
Now, you heard in
I'm
the
seeing
earlier...
itchy eyes.
Yeah, go ahead.
I'm seeing itchy eyes, sneezing, runny nose, asthma attacks, the whole gamut, skin allergy symptoms.
So a little bit of everything. You heard in the earlier story, they had some tips to lessen symptoms like wearing a mask or a hat. What is your advice to people who are just out there and we are suffering right now?
Well, there's no reason to suffer. There are excellent treatments available. So the first thing that we do as doctors is we do diagnostics. So first, we do want to make sure that it is allergies and it's not something else, and to specifically find out what type of allergy it is. So when you go to see an allergy physician, they can find out exactly what is going on by doing some pretty simple tests. And then we can tailor it to that individual and try to find out what the best treatments are. There's many over-the-counter medications, there's prescription medications, and then if we need to, we can also even boost the immune system so that you're not suffering, because there's no reason to suffer from allergies in this day.
Yeah, good to know. And I know people have been playing the game. Is it a cold, flu, allergies, or COVID for the last couple of years? So what are some of the telltale differences?
Sure, yeah, we're still seeing that quite a bit. So it can be very difficult to try to distinguish between an infection, any infection, including COVID-19 and also allergies. But there are some telltale signs. So allergies tend to affect the eyes, so itching, sneezing tends to be more of an allergy symptom. Of course, fever tends to be more of an infection where you might want to think about COVID-19 or another virus. Decreased sense of smell and taste, we tend to think of COVID-19, but also a lot of my sinus sufferers have that as a symptom as well from nasal polyps or chronic sinus. So it, again, can be difficult, and it does help to speak to your physician, or if you think it's allergies, to speak to an allergy immunology provider.
Definitely get the help because it is out there. Thank you so much, Dr. Friedlander, for your time this morning. We appreciate you, and we hope all the allergy sufferers out there get a little bit of relief. Thank you.